Coming up in just a moment, Paul Seegert. We're going to talk to Paul. He's the managing partner at PCS Advisers, which is an employee healthcare benefits consulting firm, and they're located in Northern California. And I want to talk to him and have him come on right now because he has some thoughts with regards to this. If anybody asks you the question, is President Biden and this administration denying you health care choices? Well, let's ask Paul that question. Paul, is the president denying us health care choices?
Well, they're certainly trying to discourage access or limit access to other options other than ACA exchange offered plans, if you're not looking at a group plan. So indirectly, yes.
Yeah, and probably, if COVID has done one thing, if the recent uptick of the surge at the border has done something, it's kind of taken the whole ACA, Obamacare, healthcare crisis. It's off the front of the board, right? I mean, it's kind of gone to the background now, and we're not paying much attention to it. And for a lot of people, Paul, we need to pay careful attention to this.
Well, I agree. We're talking about $5 trillion. I mean, it's a massive, massive part of our economy, and it's been left. It's everything that we've done. The ACA is a perfect example. Everything that we've done to expand access has failed to address why our system is so expensive and why care costs so much. And we then do things that actually worsen the problem rather than improve the problem. So we're not bringing in more competition, which we know. I'm a free market person. More competition and more options and more transparency is what the system needs, not less.
Yeah, that's exactly right. In full disclosure, I sold health insurance. I mean, I did life, health, long-term care, annuities, mutual funds. I did all that up until about 3 years ago. And I've got to tell you, before I left the industry as a whole, I left health insurance pretty quickly because I was extremely frustrated, and I was very frustrated in that I just didn't feel most of the time, even as an independent agent, Paul, I didn't feel like I could offer Americans the best of what they could do. I mean, for example, it seems to me that the administration actually tries to be a roadblock, or at best, a speed bump, if people seem to be going toward what we call short-term plans. And for a lot of people and for a lot of situations, Paul, a short-term insurance plan would be a great help to a whole lot of people.
Yeah, I agree. There are many cases where it's a much more affordable way to get coverage. They don't have to comply with all of the rules and requirements for those ACA plans. So that allows them to do some underwriting, medical underwriting. So it may be that not everyone qualifies for one of those plans, but that then also means that they can put together a risk pool that is pretty clean and results in lower claims and lower rates, and it can be considerably less. I mean, we look at the ACA plans. I'm actually a pretty good example of all of this. I have 5 kids. I was spending $20,000 a year to have a small group medical plan to cover my family in California, and that had a $6,000 deductible. It was a bronze plan, basically. It's high deductible, and an even $13,000 family max out of pocket. So really catastrophic coverage. And I went to a non-traditional plan, so not ACA compliant, for my family, being a healthcare person who does this stuff every day. And we now face, if worst case scenario, we would pay $500 out of pocket for a big health event, and we're spending 40% of what we used to spend on traditional ACA compliant health insurance, well below $10,000.
That's beyond amazing, isn't it? I mean, that comparison right there is enough to make you scratch your head and then just say, okay, what in the living heck are we doing with people? I mean, it's absolutely amazing. Now, you're in a position where you could switch and go to something else, but sometimes people that would like the chance to get to a short-term policy of some type to help them bridge the gap, or at least go with a plan that's not in the normal ACA community, and they get blocked and they can't always get there. And it's not helping the American people. And I'm sorry. I don't know your politics, Paul. This is the first time we've talked. But when these same people turn around and tell us, oh, and don't worry about the taxes, it won't affect anybody that makes under $400,000 a year. I remember all the promises that were given to us relative to this health insurance plan. And when one of the congressmen, in not good sportsmanship, hollered toward President Obama from the floor, "You lie," guess what? He was right, the president was wrong.
Well, yeah, we weren't supposed to be able to keep our doctors and all these kinds of things and not pay any more than we were paying. And if we liked our plan, keep it. And, of course, a lot of that had to go by the wayside. And here's the report card, really. Deductibles are up 87%. The average deductible is now $5,000, while the average American family has less than $400 in savings. We've got premiums that are up more than 87% in this post-ACA era. And we have $85 billion in medical debt that is held by insured Americans because the out-of-pocket on these plans is so high. We've, instead of figuring out a way to reduce costs, we've kind of kowtowed to the industry itself and shifted costs to the consumer more than anything else. And in so doing, we've added 31 million customers to the insurer's rolls. Still, we run with about that many uninsured. Let's make some more affordable options available to those who still fall into that gap where costs and out-of-pocket costs really do matter. Those working-class people who can afford to go get a plan, they only know to go to their exchange, their state exchange, or the whatever the national exchange to source a plan. They're not going to see these short-term plans or other more affordable options. They're only going to see these ACA-compliant plans. And they don't qualify for a lot of subsidy necessarily. They don't qualify for help with the out-of-pocket costs, and they're getting hammered. We need to do a better job.
Yeah, in the article that brought you to my attention, Michael Cannon from the Cato Institute shared the story of a 61-year-old Arizona woman. She had emergency diverticulitis surgery. I never had surgery, but I had emergency diverticulitis several years ago. Not much fun. But anyway, the entire cost of her surgery, she was able to cover it with a plan that her premium was $274 a month, a $2,500 deductible. The equivalent exchange for her would have cost her a premium of $800 a month and a deductible of about $6,000. So her premium would have been $526 a month more, and her deductible would have been over $5,000 more. How does that make sense to anybody?
It really doesn't. And when you look, that really defines the problem well. When you look at, there was a great article in the LA Times some time back. They called all around the country and they said, they called various hospitals around the country, what would you charge cash for a CT scan? The average answer was $287, and yet when they asked those same facilities, what would you charge if I pulled my fill-in-the-blank insurance card out of my wallet, the average answer was well north of $2,000.
Isn't that nuts?
That does not make sense. It does for the insurance companies, and it does for facilities. Hospitals and insurers have been big winners through this post-ACA era, while the consumer is much worse off. Employers that are, they are insuring a huge portion of our population. They are spending more than ever before to have employees feel like they're getting less than ever before. And their pay raises have been far outpaced by the increase in payroll deductions. And it's really not necessary. We need more transparency. That's the only way forward. And we've never had, regardless of a person's politics, I'm a fiscally conservative person and very in favor of the free market. And yet, when either party has had the ability, controlled both houses of Congress and even the White House and so on, to make real change in this area, it has not happened. There's so much lobbying power against it. I think the industry is going to have to, folks like us at a grassroots level are going to have to do it. And it's going to come through transparency, like this transparency rule that kicked in January 1 for hospitals.
Yeah, no, you're exactly right. When you see what hospitals can do, or they should do, or they shouldn't do, Yeah, all hospitals, I'm not going to lump them all together, but all hospitals are not necessarily our friends. Some of them are trying to make profits whatever direction they can. I mean, when you have a client, and I had a client, now this was right back at the start of the Affordable Care Act, Paul, and I had a client here in Fort Wayne, and we went to one of the major hospitals, and he was Amish. He didn't carry insurance. And so the billing, when they thought he had insurance for a procedure, a surgery on his son, was just north of $12,000. So he called me up, and as normal Amish do, he said, "Hey, you help me, I buy you lunch." And that's if you dangle a hamburger in front of me, I'll do anything. So I went with him to the hospital, and we sat there in one of the financial advisor office, and she said, "Well, 12,000, blah blah blah, and we could do payments and blah blah blah." I said, "What if he paid you cash for the entire procedure right now today, cash?" And she said, "Really?" And I said, "Yeah." She said, "Give me just a minute." So she went back to talk to whoever the big boss. I thought we were buying a used car, because let me go talk to my manager. And when she came back out, Paul, that $12,000 plus became $4,200.
Yep.
So he pulled out a wad of bills from his overalls and paid $4,200, and we were done. He was ecstatic. I was honked off, because I'm like, I'm an insurance agent. My people are all getting screwed over, and so is the company I work for.
Exactly. That's therein lies the problem. We need to put a spotlight on that. Where we see the solutions already exist. Look at cosmetic procedures and other elective procedures, surgeries like LASIK surgery. I had an elective procedure recently, not cosmetic. I don't know, for some reason I feel like I have to say that, but I had an elective procedure, and I found the best surgeon in America that did this procedure, and flew to LA, paid $10,000 in cash, got the procedure done. Had it been medically necessary, my plan would have paid, north of $40,000 for this. And I would have paid out of pocket. My out of pocket would have been, my deductible and all this stuff. So big, right? If I was on a traditional plan, I'm not. But in any case, that's really crazy. And yet, when you see those areas where it is a transparent business, elective procedures, where they have to compete on quality and price, they do. And it drives price down and quality up, like it does in every area of the economy. And we've just got this shadow up between, or this curtain up. We've got American consumers that are consuming in terms of pay. We are consuming like we do. We're good consumers, but we're consuming in terms of co-pays and deductibles, not real costs. You're shielding us from real costs. You're hiding that from us so that you can inflate it in the background, and it's a huge, huge problem. This transparency rule is fairly chipping away at it a little.
Yeah, part of the real problem too is just an educational thing. If you walked into a restaurant right now, okay, where you live in your town out there, and if I walked into a restaurant here in Fort Wayne, and if I sat down with somebody I didn't know and just say, "Hey, in the next 3 minutes, answer a few questions for me. What's your deductible? I'm not real sure. What's your copay? I'm not real certain. What's your out-of-pocket maximum? I don't know. If you had a $52,000 surgery this year, how much would it end up costing you out of pocket?" Paul, they have no idea.
The only people who know it after the fact.
Yep.
And they find out over time.
I can tell you about a kidney transplant down to the last penny.
Yeah.
So yeah, it is crazy. Real quick, 60 seconds, Paul. What's our solution to this? Is this conversations with our people in Congress? Is this conversations we need to be having with the heads of insurance companies? I mean, where do we, out here in consumer land, where do we go to get satisfaction that we really are getting the best deal and we understand it?
Yeah, we have to demand transparency, and I think we have to demand it of our Congress people. Hopefully we can get some forward movement there. It's a good step in the right direction with the hospitals, but without more of that, we won't experience a free market in healthcare, and that's where we need to go.
Yeah, I think you're right. Free market always seems to work in all other forms of life. I don't know why it can't work here. hospitals are trying to make money, and they're in competition with other people in the same businesses as them, just like everybody else. Paul Seegert, thank you so very much for your time today. I appreciate you. You can find out more about him at PCSadvisers.com. That's PCSadvisers.com. And Paul Seegert, Seegert. And you can find out more about him. Paul, I'm sure I'm going to be ringing your number again sometime in the future, but for today, thank you very much for your time and for your insight.
Thanks for having me. I sure appreciate the time.